Welcome to the Explainer. Today, we're mastering a completely foundational clinical skill that every healthcare professional working with telemetry absolutely needs to know inside and out. We're going to break down the Five-Lead ECG placement. Literally, no more guessing, no more tangled wires. Just a practical, foolproof walkthrough of exactly where each electrode goes and, more importantly, why. If you want to get a perfect, crystal clear trace on your telemetry box the very first time, you are definitely in the right place. Okay, let's dive into this explainer. Today's workflow covers essential supplies and prep, mapping the chest landmarks, placing the outer leads, positioning the V1 lead, and finally we'll wrap up with the color-coding mnemonic. Starting with Section 1, Essential Supplies and Prep, building the foundation for a clean telemetry reading. So, securing a flawless reading actually starts way before you apply a single wire to the patient's chest. Let's look at the physical gear you need to gather before stepping up to the bedside. You absolutely must have your 5 electrodes in hand, obviously, plus alcohol prep pads and a roll of abrasive tape. Oh, and don't forget the hair trimmers. If your patient has excessive chest hair, you literally have to clip it down, or those stickers just won't adhere properly. Have all of this gathered so you're fully prepared to go. Next up is getting your patient situated. Ideally, you want them supine, just lying completely flat on their back. But, in the real world, patients simply can't always tolerate that. If they're struggling to lie flat, dropping them into a semi-Fowler's or low Fowler's position works perfectly fine. And please remember, you're exposing their chest, which is a sensitive, private area. Always, always grab a towel to cover and protect their dignity as you work. Right. Once you're ready, you need to prep the skin at the target sites. First, firmly wipe the specific areas with an alcohol prep pad to strip away all the natural skin oils. Step 2 is absolutely crucial. Let it air dry completely. Don't blow on it, don't rush this. Finally, take your abrasive tape and gently rough up the area. I know it sounds a bit harsh, but tactilely roughing up the skin removes those dead cells and ensures that the sticky electrode makes an unbeatable flush connection. Just repeat this for all 5 sites. Moving right along to Section 2, Mapping the Chest Landmarks, Navigating the Bodily Geography. Now, what's really interesting about this slide is the physical process itself. I want to slow our pace down right here, because finding the correct spots isn't about guessing at all. It's about confidently feeling the anatomy. To find your starting point, locate the suprasternal notch right at the base of the throat and slide your fingers straight down until you feel a distinct ridge-like hump. That's your angle of Louis. If you slide your fingers just a little bit to the right or left of that hump, you'll feel something hard. That hard bone is the second rib. Dropping just below that second rib puts you exactly in the second intercostal space, and that is your primary anchor point. Okay, so you've got your horizontal axis, now you need your vertical axis, the mid-clavicular line. It's exactly what it sounds like. Find the beginning of the clavicle, the collarbone, near the sternum, and then find the end of it near the shoulder. Visually cut that bone right down the middle and imagine a straight plumb line dropping all the way down the chest. This invisible mid-clavicular line acts as your dropping point for aligning all 4 of your outer leads perfectly. Section 3, Placing the outer leads, securing the 4 corners. Now that we've mapped the terrain, let's stick those electrodes on. The true beauty of this placement is its symmetry. The right side leads, that's the right arm and right leg, and the left side leads, the left arm and left leg, are going to perfectly mirror each other. They run directly down the right mid-clavicular line and the left mid-clavicular line. You're essentially building a perfectly balanced box around the heart. Let's place them. First up, your arm leads. The right arm and left arm electrodes go right into that second intercostal space we found earlier, sitting squarely on their respective mid-clavicular lines. Now for the legs. You don't even have to start over. From that second intercostal space, simply keep your fingers on the chest and just count down the spaces. 3rd, 4th, 5th, 6th, down to the 7th or 8th intercostal space. Stay right on that mid-clavicular line and place your right leg and left leg leads there. Simple as that. Let's move to Section 4 and see how this builds, positioning the V1 lead, the telemetry oddball. Now that we have our 4 corners firmly secured, it's time to place the final, unique electrode right in the center. The V1 lead has a very specific home. It's placed just to the right of the sternum at the 4th intercostal space. Finding this spot is just a matter of counting again. Go back to your trusty angle of Louis. Feel that ridge, step off to the right to find the second rib, and drop right into the second intercostal space. Now staying right next to the sternal border, just count down. 3rd intercostal space, 4th intercostal space, boom. That's your target for V1. Now, you might be wondering, why is V1 placed right here? Well, V1 actually sits in the exact same anatomical position in this 5-lead setup as it does on a standard full 12-lead ECG. It provides a crucial, consistent view of the right side of the heart, which keeps your clinical data standardized across the board. Section 5, the color-coding mnemonic. Let's lock in those wires. All right, your stickers are perfectly placed, but remembering which color wire goes where can be a little stressful, so let's give you some cognitive anchors. Starting on the right side of the patient's body, the phrase you need to internalize is clouds over trees. The white wire represents the clouds, so it snaps onto the upper right arm electrode. It sits over the green wire, representing the trees, which snaps onto the lower right leg electrode. Clouds over trees, white over green, right side. Now just slide over to the left side of the patient's body. Your memory hook here is coal over fire. The black wire represents the coal, and that snaps onto the upper left arm electrode. It sits over the red wire, representing the fire, which snaps onto the lower left leg electrode. Coal over fire, black over red on the left side. And we've got one wire left for our telemetry oddball, V1. The final piece of the mnemonic is dirt in the middle. The V1 wire is brown, just like dirt, and it snaps right onto that electrode you placed at the fourth intercostal space, right near the middle of the chest. So it's clouds over trees, coal over fire, and dirt in the middle. And this brilliantly illustrates the entire setup. Look at this table to see the entire process in a single comprehensive view. It maps every single lead to its exact anatomical location and its corresponding mnemonic color. If you're prepping for your NCLEX or gearing up for clinicals, seriously, take a mental snapshot of this. It's the ultimate visual guide to exactly what we just built on the patient's chest. So as we wrap up this explainer, I want to leave you with a quick challenge. Think about the bodily geography we just navigated. Which landmark will you confidently find first on your next clinical shift? Will it be that ridge-like angle of Louis, or maybe the midclavicular drop zone? You now have the exact blueprint to trace out the perfect 5-lead ECG placement every single time. Trust your hands, follow the landmarks, and get that perfect reading. Thank you so much for learning with me today on the explainer.